Okay, everyone, time to discuss the various lesions associated with the visual pathway and the visual nerve. Okay, let's see what can happen if you infarct or if you lesion the visual nerve or the optic nerve from over here. Now, what's gonna happen is you're gonna lose eyesight in one eyeball. That is very simple. Both these pathways are gonna be affected, and you'll end up losing eyesight in one of the eyeballs over here. Okay, none of the information can actually get crossed off from here. Okay, what will happen is if you lesion the optic chiasm. This is what happens during tumors of the pituitary gland, which lies over here. This pituitary gland tumor will actually compress the optic chiasm and will result in something called a bitemporal hemianopsia. So you remember the nasal aspect of the retina actually crosses like this, and the nasal aspect of the retina detects temporal side of the visual fields like this. So basically, if you end up removing these crossing fibers or destroying these crossing fibers, what's going to happen is you're going to end up losing the temporal aspect of the visual field. Okay, what can happen if you lesion the optic tract like this over here? So remember, now the nasal fibers of the retina are actually crossing over and going like this, while the temporal fibers of the retina of this retina are actually crossing over are not crossing over and going straight down over here. So basically, this temporal retina and this nasal retina are going to be ineffective. So anything which is actually viewed on this nasal retina, which is basically the temporal side over here, is you cannot see it, and anything which is viewed on the nasal retina, which is actually something which is over here, you cannot see it. Exactly like this. Exactly like this. So this is actually called a homonymous hemianopsia. Okay, a homonymous hemianopsia. Let me write this down. Cool. And this is actually the right homonymous hemianopsia. Okay. So in other words, or another way to understand is that if you remember what I told you, anything viewed on the right side of the body will actually end up on the left side of the brain, right? Remember? So if you end up lesioning the left side of the brain, what can't you not see? Anything which is viewed on the right side of the body. This is exactly what is going on over here. Okay. So what's gonna happen if you, let's say, if you lesion the uh, optic radiation like this? So the optic radiation is actually further dividing the retina into upper halves and lower halves. Okay, so the basically the this is actually dividing the retina into upper and lower halves. So let's see what will happen if you lesion the this optic radiation, which is actually bringing information from the lower half of the retina. So if you are lesioning something on the lower half of the retina, you cannot see anything which is viewed from above. Remember, because the image gets inverted. So anything on the lower half of the retina over here, something, it is very similar to what is going on over here. The right side of the any image falling from the right side is actually not be able to you cannot view that, especially right upper side. Remember, because it's the lower half of the retina, so you cannot view anything from the coming from the right upper hand right side of the body like this. Is actually called a quadrantiopiia, and more specifically a right homonymous quadrantiopiia. Okay. Okay. Okay, let's see what can happen if you lesion the visual cortex. You infarct out the visual cortex. Let's say you have a posterior cerebral artery infarct, which is basically the artery, one of the arteries supplying the visual cortex. What can happen? Okay, this is gonna happen. This visual cortex, remember, this visual cortex is gonna be infarcted. So this something which is gonna happen is like this. Same diagram, but like this area, little area is gonna be spared. Why? The same diagram, this area is gonna be spared. The macula is gonna be spared. Why is that? Remember, the macula the area of the brain which is basically receiving information from the macula has a dual blood supply from two separate vessels. One is the posterior cerebral artery, and another one is the middle cerebral artery. So basically, that's the only area which has since it has a dual blood supply. If you infarct out one artery, if you clot out one artery, the other artery is still supplying the macula. Any other area of the brain which is not which doesn't have a dual blood supply is going to be infarcted. Okay, so the macula is going to be spared. So basically, it's a homonymous hemianopsia with macular sparing. Okay, and this is these are the lesions of visual pathway, and this concludes our lecture on the optic nerve.